I have PTSD from serving my country. All I want to do is go back to Iraq to feel normal again.
I have PTSD from sexual assault trauma, and I'm worried that because of it, I won't ever be able to have a normal relationship.
I have PTSD and have nightmares every night, so I avoid sleeping as much as possible.
Today I was diagnosed with PTSD. Now I'm feeling more anxious and depressed about it.
Hope, which that word is something I can't even tell you ever experiencing before. I don't remember a whole lot about like my pre-war days, but post-war, hope was just something that didn't exist for me.
I used to go to Naples and Venice beaches, which are near Santa Monica, California, and there are lots of homeless veterans there. And those homeless veterans are usually taking their drugs and they're zombies. They're wandering around. They don't have the ability to focus properly. They can't get along with people. Their social interaction really is very, very bad. They're feeling bad. Their physiological condition is bad. And the ones that we've worked with that we were able to get off the street and get treatment for have recovered quite well. And they've stopped taking the drugs. You have to be very careful how you do that, and they have to be under a physician's watch. But when they begin to heal the brain tissue that is damaged by the successive concussive incidents, then their behavior changes. And it's as simple as that. It is a mechanical, biological injury that can be repaired, just like an injury to your leg or arm or an infection can be cured. That's what happens with hyperbarics and some of these conditions. You fix the condition, you don't drug.
Before, my mind always immediately went to suicide. Like it was just the plan. Okay, when my son's 18 and is on his own, then I could pull the trigger and it's done. Like I don't have to deal with this anymore. And whenever something new would happen, it would just push that idea in my head, and that's where my mind always went. My mind always went to the negative. It always went to that dark place. And just over this past weekend, I realized my mind isn't there, and I'm actually stressing out. It's something I've never done, or at least remember doing before. I mean, no matter what happened, I was just like, yeah, whatever. And now, I'm stressing like a normal person.
Anyone who's thinking of helping and making any donations to a charitable cause would really do well to think about supporting veterans, police officers, anybody who has the potential of getting brain injured to do hyperbaric therapy, because the insurance companies don't really recognize yet that it can help, although we know that it can help, and we have a lot of people who we have helped that we see their lives change dramatically. I would consider sponsoring somebody for 10 treatments or 20 treatments, or if you have the money, a whole series of 40 treatments for a soldier. We're working on doing that right now. We're helping a lot of people that way, but we need the money in order to do it. And our charity, by the way, our charitable organization is 96% of all the funds go directly to treating the patients,
If I didn't finish, my HBOT, or if I never had this opportunity, considering all my personal circumstances that I'm dealing with right now, I don't even know if I'd be here right now. That's all I can say about that. It's just so crazy. I'd be the same person battling the same problem. There's so many therapies and stuff that help, but it doesn't cure it. Whereas HBOT, it actually cures it. And that's the difference. It doesn't treat a symptom. It doesn't make a symptom better. It just heals it. It goes away.